550-2310 plus 251-94-5502-310. Alternatively, you're quite free to come through live and ask your question yourselves by going to the live section and putting up your hand. Once you are then asked to give your question, please start by identifying yourself and your news agency before you ask your question. Alternatively, still on this platform, you can utilize the question and answer section. All right, so those are our housekeeping issues for today. We are expecting to be able to come through to you in French as well as English, but we will update you as the program goes on. But for now, let me invite the Director of the Africa CDC, Dr. John Kengasong, for his usual Thursday morning brief. Dr. John, good morning, and you have the floor.
Thank you, Wayne, and greetings from the Africa Centers for Disease Control and Prevention. And as usual, it is my pleasure to bring you the update of the situation of the COVID-19 pandemic on the continent. As of today, the 20th of January, a total cumulative number of 10.4 million cases of COVID-19 have been reported across all 55 member states. Of that number, 235,000 individuals have unfortunately died. If you look at the trends of last week, we continue to monitor that trend. We have a total of 48 countries, I beg your pardon, 46 countries that are now reporting the fourth wave. And 8 countries are way into the fifth wave now. Because the number is small, the 8 countries, I would list them. They include Algeria, Benin, Congo, Republic, Guinea-Bissau, Kenya, Mauritius, Somalia, and Tunisia. In terms of Omicron, 40 countries, that is 40, have now reported the presence of the Omicron virus in the country. When we compare the trends from last Thursday when we met to today, that is what we call the week between the 10th and 16th of January, and compare that with the previous week, that is the 3rd and the 9th of January, we observed the following trend. A total of 249,943 new cases have been reported, and that represents a decrease of 20%. The number of countries reporting the highest number of new cases the regions include Northern Africa with about 44%, Southern Africa 30%, East Africa 15%, West Africa 8%, and Central Africa 3%. When we now look at the number of deaths between last week and this week, we observe that there have been a 4% average increase in the number of deaths, resulting in a total of 2,791 new deaths. That compares to 2,688 deaths last week. If we now look at the 4 weeks period, that is the period between the 20th of December to the 16th of January, we have observed the following. An average of 0.3% average decrease in number of cases, and with the following regional trends: 70% average increase in Northern Africa, 53% average increase in East Africa, 33% average increase in West Africa, 21% decrease in Southern Africa, and 0.1% decrease in Central Africa. In terms of new deaths, we've observed over the 4 weeks period a 34% average increase in the number of deaths, with the following trends in the most populous countries: Nigeria, about 215% increase; Kenya, 107% average increase; South Africa, 70% average increase; Ethiopia, 39% average increase; DR Congo, 30% average increase, and Egypt 11% average decrease. In terms of testing, 92.8 million COVID tests have been conducted cumulatively since we started this pandemic. And last week alone, 1.4 million new tests were conducted. In terms of the vaccines acquisition on the continent, as of today, a total of 572 million doses of vaccines have been delivered on the continent. Of that number, a total of 353 million doses have been actually used. Our coverage today, that is the number of people that have been fully vaccinated, stands at 10.4%. Again, a few countries, just to cite those that are making good, remarkable progress. Egypt is at 22% of the population that is fully vaccinated. Morocco, 62%. South Africa, 27.3%. Mozambique, 27%. Nigeria, 2.5%. In terms of AVAT, a total of, that is the African Vaccine Acquisition Task Team, a total of 35.8 million Johnson & Johnson doses have been delivered to 35 African countries. And I did promise last week that I'll come back to you with a question of how many doses have expired. Our records indicate, as far as we know, that about 2.8 million doses of vaccines have expired. So that represents a 0.5% total number of vaccines that have expired on the continent. And these are mainly vaccines that were donated and came with very short notice. Important to note that none of the vaccines that were delivered through the AVAT platform, that is the Johnson & Johnson doses of vaccines that were procured by the member states themselves, have expired. So I just wanted to be sure that I end on that note, because I took a promise that we'll find the answer and get back to you. Thank you, Wayne, and over to you.
Thank you very much. That was Dr. John Nkengasong, who is the director of the Africa Centers for Disease Control and Prevention. So we are now moving into our question and answer section. And I'm just waiting for your questions, colleagues, because I don't have any. While we are waiting for that, let me remind you that we have French interpretation, and so you can select the language of your choice. Just checking again for your questions. All right, let me put one of my own while we wait for your questions to come in. But in fact, I see now that Sarah Jerving has put up her hand. So Sarah, you are our first caller today. Please go ahead with your question.
Thanks so much. How many countries are using self-administered COVID-19 rapid antigen testing, specifically the self-administered one? And why isn't this being widely used across the continent? And then could you also just talk a little bit more about why you think the AVAT doses have not expired?
So let me start with the second part of it. I think it has to do with the long shelf life that the vaccines come with. And it's really a measure. I mean, these vaccines, the Johnson & Johnson vaccines that we procure from AVAT, do really have a long shelf life. I think that is important. Second is that perhaps this is because these are single shots, where people come in once, you get their shot, and that is it. The other vaccines require that you actually program it in such a way that there's one dose there's one shot for the first dose, and second. In between that, a lot can happen. That in terms of people not coming up for the second dose, and that leads to the expiration of the second dose there. So it's very possible. I don't have the exact reasons, but those will probably be most of the reasons that or the main reasons that the Johnson & Johnson other doses have not expired. In terms of the antigen tests, I will not be able to give you the specifics of the self-testing, but I believe that we can definitely get more information from our lab colleagues and share that with you. In terms of self-testing, which I believe should be the way to go in 2022, decentralized testing and make it self-testing so that people can know their status and actually isolate themselves. That is the only way to continue to arm the community to be in control of this pandemic.
All right, thank you very much. Let's say hello to Coletta Wanjohi, who is with FSN. Good morning, Coletta. Please go ahead.
Okay, good morning, Madam Wine. Can you hear me?
Yes, we can hear you. Please go.
Okay, good morning, Dr. John. You've just talked about the expiry of vaccines. I mean, where are we headed to in such a case? Because what can we do to ensure that we don't have expiring vaccines in our hands in a situation whereby we're still battling to supply enough, and at the end of the day also we're still battling to kill the issue of vaccine hesitancy. Where should we go from here in terms of avoiding this?
So avoiding that, Coletta, we have issued a statement provided a sort of guidelines on how to donate vaccines. And we co-signed that guidelines with several partners, including Gavi, the WHO, UNICEF, where essentially we are saying that there should be two main things. One is that vaccines that are delivered should have an appropriate shelf life. Second is that the notification of the countries way ahead of time, at least 4 weeks before the vaccines arrive. So if you say to a country that you're delivering vaccine in 2 weeks, and by the time the vaccines arrive at the airport in Nairobi or Addis Ababa, they clear customs, then they carry them to the storage facilities and start distributing them to their countries. It is into the interior of the countries or other cities in the country. It is already more than 2 weeks. Okay, and if those vaccines have a shelf life of maybe 3 weeks or 4 weeks, it becomes obvious that the vaccines will be expiring. So I think that is one. If we just address that piece alone, that will be very, very helpful. So we just don't have a record of those that have received vaccines with a long expiration date and they've actually expired. I think I would actually speculate that that case scenario is very limited. Okay, where people have advance notice, they plan for the vaccines, they arrive, they will be able to use it.
All right, thank you. Let's go to Lucia Blanco, who works with the International Spanish News Agency, the EFE. And what she has is just a request for clarification. And she's inquiring for you to confirm that you said that the expired vaccines are from COVAX and bilateral donations. So she wants clarification on that.
Mainly from bilateral donations and COVAX. That is what the information that we have. So that's all I can clarify.
All right, thank you. Let's say hello to Alexander Winning, who is online. Alexander, good morning. Please go ahead with your question.
Good morning. Can you hear me?
Yes, we can hear you very well.
Great, thank you. I'm from Reuters in Johannesburg. The first question is, Dr. John was just now speaking about an appropriate shelf life. Could you say what that appropriate shelf life might be? Obviously, it might vary from country to country to some extent, but are you saying that, the Africa CDC is saying that countries need a minimum of 3 months, of 6 months? How long does that shelf life need to be specifically? And then the second thing is that last week you mentioned you were in close discussions with Pfizer about their Paxlovid pill. Are you also speaking to Merck about their pill? If you aren't, is there a reason why you have a preference for Pfizer's treatment pill over Merck's one? What's your thinking behind that? Thank you very much.
No, thank you. Very good questions. I think an appropriate shelf life for vaccines will be somewhere between 3 months to 6 months, so that countries can properly plan for the logistics of moving the vaccines around. So I think that will make absolute sense for me. And so some certain countries are actually refusing totally to accept the vaccines because of exactly that. If they see that the shelf life that of the given vaccine is only 1 month or 2 months, they prefer not to receive those vaccines because it will create a narrative that vaccines have expired in their countries. I think most countries are very sensitive to that now. We don't have a preference to talking to only to Pfizer and not Merck. I mean, it's just that Pfizer has been more forthcoming with in their engagement. We plan to engage both companies equally. It's just that arrangement is far advanced. That is the Pfizer arrangement is far advanced. If you recall, Pfizer was very upfront saying, look, we want to make this available. We also want to share the technology so that this can be produced more regionally and more globally. So I think with time, if we nail this down and finalize the Paxlovid arrangement with Pfizer, I'm sure we'll engage with Merck as well.
Thank you very much, John. Let's say hello to Judith Akolo from the Kenya Broadcasting Corporation in Nairobi. And she has a question about lessons learned. So she says her question to you is, when we compare the duration of the Spanish flu of 1918 to COVID-19, is there anything that we did not do that if we had done could have helped us to deal with COVID-19 pandemic?
So that's a very good question, Judith. If the people that fought the Spanish flu in 1918 were here today, the first lesson that they will learn is that science has advanced tremendously, significantly. I think the poor folks at that time were dealing with a pandemic that they didn't even know what it was. Okay, if you recall the history of that pandemic, they only could analyze the genetic sequence of the virus in about 1930. So when the pandemic was completely over. And here we are with a virus that was identified first identified in December. And by January, we knew the sequence of that virus. That is very important. That created an avenue for us to develop a diagnostic test and develop vaccines and very, very quickly. So I think they will also be amazed with the speed at which we could unpack the genetic material and use that information to develop vaccine. Never in the history of infectious diseases have that I'm aware of have a new entity been identified, and within 1 year a vaccine developed, undergo clinical trials, both phase 1, 2, and 3, and then get into people's arms. I think that is incredible. That is a lesson that a sharp contrast with 1918. 1918 flu ended within 1.5 years to 2 years, but it killed the 50 million people because it was it kind of just took away the vulnerable massively. And then, of course, because it did that, it created herd immunity in the population and started blunting the spread of the virus. I think that was remarkable. I don't recall that they had as many variants as we have now, but it is natural that viruses will mutate and create variants. So they still remain the same virus, but they may have different properties. So I think that is very different. So I think there's again, similarity exists, of course, because it's called, the only reason it's called a Spanish flu is because at that time, Spain was more open to that. And then it was labeled the Spanish flu. It's not because it was identified in Spain. No, it was just because at that time, I think the king for Spain and the Spanish press was very vocal about that. It became named the Spanish flu. So some similarities there. The same methods that we are using today are borrowed from that pandemic. Masking, I don't think that they had the N95 mask at that time or N94, but the same principle apply. Isolation, use whatever you have to protect yourself and cover your face.
All right, thank you. Let's cross over to the South African Broadcasting Corporation and say good morning to Sophie Mukwena. Morning, Sophie, please go ahead with your question.
Good morning, Dr. Nkenkesong. The President of South Africa yesterday indicated that South Africa is looking at lifting the state of disaster. And that simply means those restrictions that are currently in place are likely to be removed. And we saw the United Kingdom yesterday doing almost the same, even going as far as doing away or announcing that they will do away with those non-pharmaceutical interventions, such as wearing of masks. How do you feel? Do you think this is the right time to do that? Are we in the endemic situation, or are we still having a pandemic?
Oh, no, absolutely. We still have a pandemic, Sophie. Let that be no doubt on that. Let's clarify one thing, if I may. An endemic situation doesn't mean that we live with a high level prevalence of a disease or deaths. An endemic situation is where you have brought down the prevalence of the virus to a level that you can live with. And I don't believe that we have brought it down to a certain level that we can live with. Now, living with, meaning that we still have to do surveillance, have the treatments around, and continue to vaccinate them. And endemicity doesn't mean that it's not going to hurt you. I mean, remember that HIV, malaria are all endemic, and then they kill about 1 million people, the two of them, tuberculosis and malaria in Africa every year. So I think moving to an endemic thing doesn't necessarily mean a good thing. It only tells you that the virus is with us. In other words, to put it very bluntly, if we declare today that COVID is endemic in Africa, it means that is the level that I believe that we will live with, which is with a positivity rate, an average positivity rate of 11%, which is extremely high. So I think just to say that endemicity doesn't mean a good thing. It only means that the virus is there with us. But public health-wise, you only declare that when you've gone down to a certain level that you can only sporadically find the virus, test it. We have to live with the fact that we may not completely eradicate this virus or control it, but we may bring it to a level that it will be like an outbreak. You hear that there's an outbreak in some parts of Johannesburg or Cape Town, then you massively mobilize resources to go there and tackle it. That is the scenario where it becomes endemic, like the seasonal flu, right? I mean, it comes in every season and then disappears and stuff like that. That would be a classic case of endemicity. Now, whether I've not looked at the information from South Africa, I don't know what is exactly in they are lifted or plan to lift, but South Africa did a remarkable thing at the end of last year, where they look at the data and they said, well, we're getting more infections from Omicron, but we are not seeing a corresponding increase in number of deaths, and we are not seeing our hospitals overwhelmed. So we'll maintain. Will not impose additional restrictions there, which I think is a big lesson to learn, a big public health lessons to learn, and it has inspired us to the extent that we look at that data also, and we were able to use that to inform a decision that this next summit of the head of states should be a face-to-face in Addis if we do certain things. We impose that everybody who comes in there wear a mask, specifically the N95 mask, to ensure that we really diminish transmission. With that, people that comes with the delegation are vaccinated, and that we do routine testing every day then we mitigate that as much as possible. So we continue to learn how this virus behave and use science to inform decisions and make policies there. So I look forward to reading more about the South African, what is it specifically that South Africa plans to do so that I can properly share my views on that.
All right, thank you. Time to say hello to Vinicius Assis, who's writing to us from Brazil. And Vinicius says, what is the big issue in terms of vaccines expiring? And why are there countries that are still not able to use it in time? Why are countries not able to use their vaccines on time?
The vaccine expiration, as I said earlier, is mainly related to the short expiration date that arrive. It doesn't mean the vaccines themselves have, when they leave the factory, they have a short expiration date. It only means that a vaccine that is shipped to country X had arrived the country of origin and probably stayed there for more than half or the shelf life, and then is shipped to a third-party country at a point where the expiration date was coming very, very close. So I think that is all that it means. Second thing about vaccine delivery, which must be the focus for 2022, is the logistics. The logistics of moving those vaccines from the airport, from the time they arrive to the mode to where we call the last mile. That is going to be the big fight this year for us to strengthen those systems, the delivery systems, the distribution systems, the engagement of the community. We've seen a remarkable uptake of vaccines in settings where we engage the community, like the religious leaders, and they simply need to go into the church service or the mosque and make an announcement and build that rapport with the community. Then after church services, you actually see an increase in uptake of vaccines. We also have to be innovative and bring vaccines to the population and not only require that the population should go to where the vaccines are. In the scenario I just described, we saw that by just bringing a caravan that contains vaccines and positioning it outside of a church or mosque, increase uptake because immediately people left that facility or their worshiping center, they move into a vaccination center and were able to be immunized. So we have to be very creative in order to facilitate uptake of vaccines. We have to be innovative in the ways we behave. Of course, there will be standalone vaccination centers where people can move there and get vaccinated, but we should also have mobile vaccination centers where we can bring mobile trucks with vaccines and healthcare workers to certain populations.
Thank you very much, John. We have a nice message here coming from Lillian Luwaga. And Lillian says she's just writing to say Happy New Year to Dr. John and to me, and to thank us for these regular updates. So thank you very much, Lillian, for that really nice and encouraging message. I'm seeing that Sarah still has her hand up. Sarah, do you have a second question?
I do, thank you. So we've heard a lot about the concerns around expiry dates over recent months, but the percentage that you noted in your opening remarks seems to be very low. Can you put that percentage in context?
Well, we're coming out of that presentation by the Africa CDC, this week's presentation. Quite a few facts coming out, but the most interesting one I thought was the fact that statement by Dr. John Nkengasong that 2.8 million doses of vaccine that had been donated to the continent has expired. Quite an interesting one. Let's take a break. You're watching The Agenda.